All right, I guess we can start. So, good morning, everyone. So, it's wonderful to see everyone here. And for joining us this morning, I am Dr. Kayna Palinga. I am a developmental and behavioral. And with me is Mary Ann Morales, who is a physical therapist. And we will be your hosts and moderators for this morning. Good morning, Mary Ann.
Good morning, Doc Kay and everyone. We have a great talk for today, and the topics that will be discussed are considerations in the care of athletes with ADHD, choosing single sport versus multi sport for children, keeping in shape during COVID 19, tips for school age children and teen athletes, and conducting a physical education class online. As you know, these topics are very relevant during this time as our children and adolescents are not able to leave their homes and have not been able to continue or do regular physical and sport activities.
All right. So today's webinar is brought to you by the MedMom Institute for Human Development and the Medical City section on developmental and behavioral pediatrics. So both of these clinics cater to all neurodiverse children. So for a better viewing experience, we would request everyone to put their mics on mute. And then if you have any questions, please feel free to type them on the chat box. And we'll do a Q&A session at the end of the talk where you can unmute your mics and ask your questions directly. So it is a great pleasure for me to introduce our speaker this morning. Dr. Pujalte has been a friend of our family since he was a young student at the Philippine Science High School. After graduating from medical school at the University of the Philippines, he trained in Mount Sinai in Chicago, where he served as chief resident. He then underwent sports medicine training at the University of Michigan, where he was faculty for a year before moving on to Penn State, where he was part of the faculty in the departments of orthopedics, rehabilitation, and family medicine. Currently, he serves as consultant, vice chair of research, and associate program director of the Sports Medicine Fellowship Program in Mayo Clinic's Florida campus. He is also an associate professor of the Mayo Clinic College of Medicine. His areas of interests include martial arts, sports medicine, and sports psychology. These days, Dr. Pujalte combines his personal interests in martial arts and sports psychology by serving as team physician for USA Taekwondo. He was also recently named by World Taekwondo as one of its commissioned physicians. He has served as team physician for USA Taekwondo and has been a commissioned doctor for World Taekwondo in numerous events around the globe. He has also presented at the World Scientific Congress on Martial Arts and Combat Sports. Please join me in welcoming Dr. George Pojalde. Good morning, George.
Okay. Hello. Good evening from
Or good
I
evening
am you.
in
Good
the US.
evening. Yes, yes. From the happiest place on earth. I'm at Disney right now, but doing this for you guys. I'm sure it'll be fun because Dr. Napalinga asked me to talk about a lot of things, which is good because it tends to be very boring when it's just one topic. So, as Dr. Morales had mentioned, she wanted me to talk about considerations in the care of athletes, which is one of the articles we published from Mayo Clinic, athletes with ADHD. And then Dr. Napalinga wanted me to talk about single sport versus multiple sports for children, and then keeping in shape during this pandemic. And then finally, how to hold physical education classes online. And then we'll go through some take-home points at the end of this. So I have a few disclaimers. I've been away since 2001, so I'm not truly acquainted anymore with Philippine medical practices, but I will proceed as if everything we do here is exactly what you guys do. So with that being said, looking at MedMom's structure though, it looks very similar to what we do in sports medicine here. It's very multidisciplinary. So that's something that I noticed. Obviously, I try to see, I check out what the audience will be, and MedMom structure, if you're wondering, what our structure in sports med, it's quite similar. The only thing I didn't see were athletic trainers. We have a lot of those here in the States. But other than that, you guys have sports therapists, sports psychiatrists, sports orthopedic surgeons, and team physicians as well. So the one thing too is that the popular sports in the U.S. is very different from the popular sports in the Philippines. So here it's American football and basketball and baseball and then hockey. Obviously, in the Philippines, I don't know if things have changed, but it was basketball and billiards and soccer when I was still there. So it's a little different when we talk about sports injuries here as opposed to sports injuries there. And also the sports seasons are quite serious here. I'm sure doctors Morales and D who grew up here would understand that when I say football season, that's a really serious season. Baseball season is a distinct season. Basketball season is the same. So these seasons are very different in the US. Also, when we go to the talk on multiple sports, that's what I'm talking about. When they play baseball and they also play basketball, I'm talking that there's no rest season. They're going from one season to another. And then finally, one of my disclosures is that I'm now in Mayo Clinic, which is a three shield concept: patient care, teaching, and research. These are the three shields of Mayo Clinic. What that means concretely is I'm paid to see patients only a third of the week, and then a third of the week I'm supposed to teach, and a third of the week I'm supposed to do research. This has a bit of an implication when you listen to me because I know how it was when I was still in Penn State and Michigan, where this is not the system. When I was listening to some of these speakers, I would say like, this is not what I see in clinic, and all I did there was see patients in clinic. The difference now that I'm in such a system as the Mayo Clinic is that when you're doing research, you tend to see not what's happening in just one setting, but in different settings. And so you have a broader viewpoint of what's going on in the science. The other thing that's different too is that whatever you find out in research, further science actually shows it takes about 7 years for that to show up in clinic. So there's a bit of a lag. So while you're listening to me, if you say something like, what that's baloney, that's not true, you might want to wait 7 more years, and it might you might actually start seeing it what I'm talking about research wise. So there is an advantage in the sense that I get to create new knowledge in research, but the disadvantage is I'm no longer seeing as many patients as probably you guys in clinic. So a few disclosures. I do have studies going on with Bristol Myers Squibb and Merck in which they pay us a lot of money. And then American Medical Seminars pays me to talk. And then when I cover for the USA Taekwondo team, they pay for the tickets, the hotels, the gear, obviously the Taekwondo gear, and a stipend. So let's dive into it. The first thing is our article on the considerations in the care of athletes with ADHD. Obviously, if you have ADHD as an athlete, it'll be very difficult to focus on tasks, be attentive, patient, and organized. But we found through our research that there are actually sports in which athletes report that impulsivity is an asset. The quickness, the ability to trick opponents with unpredictability, they say that for those sports, it seems to be an advantage. So let me just minimize this. Um, so let's look at these instances. This is from the Rio Olympics. So, kick to the head, that seems straightforward, but kick to the trunk, straightforward. But take a look at these motions. Is it going to the chest or the head? You're not entirely sure. It happens so quickly. Is it going to the chest, the head? Oh, it's a kick to the head of the other opponent. So the unpredictability is certainly shown there. And when you have that ability to be unpredictable, it can it can lead to concussions as well. If you saw that last move, very unpredictable. The opponent caught the foot, and then the opponent suddenly makes a twisting move for a head kick. Those athletes say that ADHD actually helps them kind of be unpredictable in martial arts. Obviously, I also cover football, which is the number one cause of concussions here in the United States. You get hits like these, or I used to cover professional baseball and USA baseball, and we get hits to the head with a ball traveling at 80 to 90 miles an hour. And then obviously when I covered hockey in fellowship, there were also injuries to the head from the stick or being checked onto the boards. And the problem is the athletes with ADHD appear to have impulsivity and the lack of fear of consequences, which inherently increases their risk. And when they do get concussions, their symptoms actually mimic those of ADHD. Further, when they have ADHD, if they do have concussions, their symptoms are worse if because of the pre-existing ADHD. So as I mentioned, our management in sports medicine here is multidisciplinary. So we have obviously sports psychologists, psychiatrists, team physicians, and then we coordinate with specialists in the classroom as far as the education of these athletes. As team physician, our team physicians, as a team physician, my job is to monitor the athlete's symptoms, make sure they're not having side effects, which we'll talk about later, and then make sure that they're doing well because these athletes are actually students. And so they're not just athletes that need to perform in the field, they also have to maintain a GPA. So it's my job to actually coordinate with a school principal or academic director of the schools so that they can be given accommodations if they need to, so that they can perform well in the class as well. We all know about the stimulants, amphetamines, combinations of its derivatives, methylphenidate, atomoxetine, or stratera, as we call it here, which is the first non-stimulant approved for ADHD in children and adults, and then clonidine and guanfacine, which are approved for use in pediatric population from 6 to 17 years old. However, all these treatments may adversely affect athletes. So for the amphetamine-based, they can cause certain central nervous system and cardiovascular stimulation. Demands of the sports can raise the temperature of this patient. So I constantly watch out for heat cramps, which is the most common one I've seen. Very bad heat cramps where football athletes need to be hosed with cold water or dumped in cold water just to control it. And then cardiac arrhythmias, obviously, you don't want to see that as well. So as a team physician, it's my job to be aware of signs and symptoms of ADHD to recognize undiagnosed cases. If you are to become a team physician, you will probably travel a lot, so you have to know the resources in the communities you go to. And then, as I said, you have to treat the athletes to help them succeed in both academics and sports. And then you have to know what they're on, what medications they're on, and know which athletes are already on medications. So it's easy when you're covering football because you cover them for an entire season and you get to know them, kind of feel like you're the dad or the mom of the team. You know which medications they're on, how long they've been on it, which athletes are on medications. It becomes a bit more challenging when you're traveling with them. So it's different when it's a bunch of Olympians. There are a few of them, but then when they're like this team, which is the World Taekwondo Championship team, then it becomes a lot of reading into their history, what side effects have they experienced, who among these have had concussions, and even worse when it's like the Junior Olympics, where there's a lot of kids that you have to read on, and then you have to deal with the parents as well. So it becomes more challenging in that sense when you have to um, get to know a large group within a specific trip. Like, you have only like 1 week to read about everyone. Still, though, most of the professional organizations and Olympic organizations say that athletes should actually avoid ADHD medications, even though studies clearly show that these medications are beneficial. So, as team physicians, we have to make sure that the athletes who need them are medicated and then make sure that we protect them from the side effects, especially during sports, specifically CNS problems as well as overheating. The other part of this is that ADHD treatments have been shown to actually provide advantages in athletics. So when I used to cover USA baseball, this is my son, this is not me. I used to bring my son to these coverage. When I used to cover USA baseball, I noticed a lot of the kids were actually on ADHD medications, and it's hard to tell whether they were taking it because of ADHD or whether they wanted the advantage of the medications. or maybe the baseball as a sport self-selects to people who have ADHD. It's hard to tell. A lot of things are still unclear, but our job as team physicians is to make sure that we're differentiating those athletes who need treatment versus those who are just taking the medications hoping for performance enhancement. So in the major leagues, like I said, when I was covering um, like professional baseball, we actually had three psychiatrists who had to vote um, uh, to decide whether an athlete really needs to be on these medications, because it's shown that they can give advantages. So some of the baseball players, they would tell me on medications they can actually slow down the ball coming to them at 90 miles per hour, so slow that they can see the stitching on the ball. I'm not sure if that's true, but they tell me that they're able to react faster to the ball, obviously, when they're on medications. So obviously, if we ever have athletes getting into that level, the elite levels, we have to make sure that we know the guidelines for their organizations. So basketball is very popular in the Philippines. If you have anyone at that level, you probably have to know the FIBA rules for that athlete, and be sure to know how to fill up these therapeutic use exemption papers so they can take those medications. This is an example of the USADA, or the US Anti-Doping Agency therapeutic use exemption form that I have to fill out for these athletes who are on such medications. Whew, all right, so change topic: single sports versus multiple sports for children. I realize some of you may be having some whiplash from the change of topic. So not a lot of segue, but now we go to the next topic. Single sports versus multiple sports for children. Obviously, there is a thinking that if you specialize, you'll be more successful and you get to the elite status more. So, most of the time, the ones who think this are the peers, the parents, or there's a pressure to get into scholarship, especially in the United States. The colleges offer, I mean, even the good ones like Harvard, Stanford, these have football or baseball scholarships, which will pay for promising athletes. So there's that incentive to be good in sport. The coaches also have that incentive for their own career. So if they have a promising player, they want that player to be good, and they think specializing is the key. So 75% of the pressure of transitioning from playing sports for fun to intensive high-level training, it actually comes from the coaches and parents. It doesn't come from the athlete, which is not good, because when you look at football players in the NFL, the National Football League, which are the professionals who earn millions of dollars, 88.3% of them were actually multi-sport athletes when they were in high school. They didn't play football only. So you can already tell that there might be something going on as far as being multi-sport that gives an advantage. Um, the study of youth sports specialization is actually relatively new, and the definition that Neeru Jayanti and his colleagues gave is that it is year-round intensive training in a single sport at the exclusion of other sports. Let's look at basketball, and in the NBA, there's a bit more players who are not multi-sport athletes. There, about 85% played only high school basketball. But take a look at this. Most of them actually had a lot of injuries that made them miss games. Had more than one major injury when they were not multi-sport. They only played basketball. And at the time of this study, more of these athletes were actually no longer in the NBA as compared to those who were multi-sport. Though they were fewer, they actually missed fewer games due to injury, and they sustained fewer major injuries, and they were still in the NBA. So I know that basketball is very popular in the Philippines, so that might be something to advise parents that it might actually be more advantageous to be multi-sport if your kid is dreaming of becoming a pro in the PBA. So obviously, because of this, there's been an increasing negative connotation of specialization in youth sports. The American Academy of Pediatrics, the ACSM, and AMSSM, these organizations that I'm part of, they all said in their position statements that we shouldn't have young athletes specialize early. It's the intense repetitive physical demand that causes overuse injuries. You can see here that if they specialize, they have more previous injuries, this yellow bar here, when as compared to when they're not specialized. And the specialization is significantly associated with injuries in the knees, in particular patellofemoral pain, Osgood-Schlatter, patellar tendinopathy. These are the ones they noticed. All right. Now, talking as a researcher, though, not as a clinician, we all know that systematic reviews are on the top of the evidence ladder here, pyramid rather. When you look at systematic reviews, the evidence that show this is actually limited, and most of the studies that show this are actually retrospective. As you noticed a while ago, we talked about people already in the NBA or people already in the NFL, and then you look back and see, oh, they specialize at this age and this age. So that's how the studies are coming out. There's also a sign that most of the injuries that are reported are minor, like patellar tendinopathy is not such a big deal actually, and patellofemoral pain, not so much of a big deal. There are actually very few prospective studies that exist that show increasing in overuse injury and then following them. So the ideal study would be to say, hey, you guys, you always do one sport. You guys, you only do several sports. And so let's follow you through the year, see how many injuries you get. And that would be a better study than these retrospective studies. So, based on the best studies right now, the systematic reviews, we can actually say that the true risks and benefits of early sports specialization is not fully understood at this time. What we can tell the parents is that early sports specialization plus structured training may be detrimental. So, strictly speaking, that's what you can actually say. And as far as the optimal age, it's not fully elucidated. So, what do we actually know from retrospective studies? So, looking at studies on athletes in which their sport is won by centimeters, grams, or seconds, uh, you can say that if your athlete is dreaming of becoming elite, like internationally good in world championship quality or Olympians, these athletes usually specialized by the time they were 15, only when after 15. For those who were dreaming of college, like college prowess or college prowess or national renown, they usually specialize around 12. So we can say that retrospectively, it seems that these elite athletes started only playing their specialization or their one sport that they're good at in the Olympics around 15, and these college superstars or professional or national champs, they stopped doing other sports at around 12. That's retrospective. However, that being said, a new prospective case control study came out just in time for this talk, June 25, 2020. Basically, this is very interesting, again, from Dr. Jayanti's group. Um, they show that female athletes were more at risk for all injuries and overuse injuries, and that youth athletes basically there are two things to remember if they are training. So if they're training in weekly hours in excess of their age, for instance, a 10-year-old who is in training 12 hours a week, that they have a significantly more likely chance to get injured. If they are training twice as many hours as they're doing free play, they're probably going to get injured as well. So, for example, the same example, a 10-year-old kid who plays basketball maybe 5 hours a week, but the coach also makes them train 12 hours a week. That athlete is probably going to get injured. So weekly excess in excess of age hours and twice as many training hours as compared to free play where they're just playing for fun. So now we go to the question that you want to talk to your patients and parents about, athletes and parents about. Are multi-sport athletes better than single sport athletes? So again, there's different opinions. You can say that. You can say that every athlete is different, and you can say it depends. Again, we can also say, like, based on the latest evidence, if it is structured play and it's more than twice the number of hours free play, as well as more than the hours of structured play is more than the age of this patient, then it's probably harmful for him. With that being said, we can also say that professional athletes and coaches are actually speaking out now against sports specialization. All these organizations here in the United States are saying sports specialization might not be such a good thing. Also, the coaches are finding that people who are athletes who have multiple sports were more naturally talented and were better athletes because of experience that they gained from various sports teams. It seems that they are more competitive, more well-rounded, cross-training, different types of coaching, different types of locker rooms. I can tell you that the football locker room, there's a lot of cursing, a lot of negative energy going in there, a lot of anger. But when you go into a baseball locker room, it's more chill. There's a lot of cha-cha music, samba music going on. It's more relaxed. Those things tend to shape an athlete and make them well-rounded. Even the environments they practice in, and obviously the different challenges in each sport. Also, when athletes push too hard, the sports can actually become a negative thing. And actually, most talented professional athletes still compete in other sports in off season. Let's take a look at this graph. It shows that Olympic champions actually started playing other organized sports much younger than. Um, uh-oh. Am I still on? I heard a beep. Hello, can you hear me?
Yeah, you're still on.
Okay, sorry. Um, I heard a beep indicating that I was offline. Anyway, so going on, Olympic champions started playing other organized sport at around 5 years old, and they actually kept on doing that for about 10 years. So 5 years old, 5 years old to around 15 years old, they kept doing that. National class athletes, they started playing other organized sports around 9 years old, and they kept on doing that for about 4 years. So the more they persisted in multiple sports, the more Olympian level they became, at least retrospectively again. So let's go to pros and cons. Let's say we do that a lot here in the United States. They ask the parents say, hey, what are the pros and cons of doing this? So the pro is if your athlete plays football and also runs track or plays basketball, they have been shown to have improved footwork and hand-eye coordination. There's also a lesser chance of burnout. So they've seen that as well in the same manner as they've seen injuries. The more your single sport, the more likely the athlete is going to have loss of desire to play in college and not actually play in college. What are the cons? So what if the athlete is elite in a lot? So what if he's good in football? He's also good in baseball. He's also good in softball and soccer. Now he has to decide what sport he wants to go into, and that decision might shape him for the rest of his life. He might actually have been better if he'd stuck with football instead of basketball, for instance. And obviously, that's a challenge for the elite athletes. Also, a lot of the athletes that I do see, the football is their main sport, but they also are good in basketball. But basketball is a secondary sport, and then they get hurt in basketball. Now they can't play in their main sport. They can play in football, and that's missed time, and then they don't get drafted into the NFL. So there's that, and there's obviously also time and money. So if you're a parent and you have pay for the soccer of your club team of your other child, and then swimming classes for the other. It's a lot of time and money, and it also takes away from your time together as a family because the dad has to bring the daughter to soccer, and the mom has to take the other child to gymnastics, all that. So it takes away from that time, the cohesive time of the family. That's the con. What about the pro? So there is some evidence that if you specialize in one sport, then you perfect that skill. I mean, that's intuitive, right? The more focused you are, you master sport by focus, and confidence level increases. This is where you get into the talk with their patients and their parents. So what is the dream of your child? So you can see here that about a third of youth athletes hope to become professionals. Oh, he wants to be part of Ginebra San Miguel. I know if they're still good, but when I was there, Ginebra was good. So anyway, so about a third of them want to go into the pros, but actually only 0.04 of high school athletes were drafted into the pros. That's American figures. I'm sure NBA PBA is just as hard as NBA. So I mean, the figures are probably similar. 0.04% of high school athletes in the Philippines will probably get into the PBA. Same for college athletes, 0.7%. So that's really hard to get into. And even those who were very good in college, I mean, these are draft eligible athletes. Only about 3% of them get into the pros. So might be good to talk about your son about that dream. So if that's the dream, then it may not be actually achievable by specialization. And cons of it, we already talked about burnout and overuse. There is a way though. So if that's absolutely what the athlete wants, there is a way, and the basis is strength. You can see here, for children, for males and females, you begin with strength at 2 to 4 years old, and then foundational movement skills, and then middle childhood, you begin again with strength, and then now start sport specific. Teach them some agility and speed, and then put in some mobility and flexibility all the way up to adulthood. But here's what we're talking about, where we kind of start with hypertrophy training, or exercises that cause muscle hypertrophy along these years of the child or adolescent. So there is a way to do it safely, but the basis is strength, and it is stepwise. So you might argue that, hey, if this is absolutely what you want, you have to work with a sports physical therapist. And here in the United States, they have strength and conditioning, specialists which will do this. This is why most sports here, they almost always have a strength and conditioning specialist. So we might end up saying neither path is maybe better than the other. Like I said, you might want to ask the parent, what does your athlete want to do and why? This will means focusing on one sport versus split time between multiple sports, which is a bit safer, it looks like. But another thing they might want to consider is the coach. Like we talked about, coaches are starting to want multiple sports athletes, which is important to think about. I might believe, I might think that also Philippine coaches are starting to see the science about this. But look, some of the best schools here, majority of their athletes are multi-sport athletes at that level. So that's something for your young athletes to think about. All right, whiplash time. So, change topic. Keeping in shape during the COVID pandemic. So, tips for school-age children and youth athletes. Obviously, the pandemic has changed our world. It has significantly interrupted our routines. Sport seasons are postponed. Everything that every place that we used to go to for exercise have been closed. So there's now a movement to have people exercise from home. We know that staying physically fit for everyone, not just for athletes, improves the health, it reduces injury, improves mood, reduces stress, improves sleep quality. For athletes, though, it's even more important because they have to maintain a baseline fitness. And this is something that we're discussing now because in the South, which does not believe so much in science compared to the North, football teams have opened here. So, in fact, in 2 weeks, I'll be covering American football again. Whereas in the North, the Big Ten programs have postponed their programs. So what's going to happen is you have all these athletes who have a lower baseline, and they're going to go into football games, which is very stressful on the joints. The same speeds. So there's fear that there will be an epidemic of injuries because of this loss of baseline fitness. A lot of these athletes have been sitting around for longer periods of time than they're used to, and that has been shown to cause deconditioning and make people prone to injury. So, if it is to happen, the precautions still have to be in 6 feet from others, masking, and then constant hand washing and surface cleaning. Within that basic baseline fitness kind of thing, the skill work has to be in there. And obviously, there's going to be some creativity that goes in as to how the skill work for the particular sport can be maintained. And so you can see these athletes trying to be creative on how they practice at home. This guy in volleyball, this pitcher trying to hit that ball, and all sorts of inventive ways to be practicing individual skills in their sport. A good thing with the pandemic is it might be time to recover and address nagging aches and pains of these athletes. So a lot of the athletes we see, they never got a chance to treat their recurrent ankle sprain. So now's the time. So we rehab them. This is the preparation, and we kind of long term think them, where we make them imagine what they could be if they actually did rehab. If you are going to look at injury risk, again, strength comes into play. So strength training actually it leads to more significant decrease in injury risk than anything else, and proprioception as well. And then multiple exposure programs are good as well. But the basis still for injury risk is strength training. We do see a lot of our athletes doing these stretching, yoga. These are good as well. But for athletes in particular, maintaining the strength has to be in there. And then there's the psychological part of being in a team sport, for instance. The athletes need to feel they're still connected to a team. So it's a team sport. So obviously they need constant social integration, group chats, stay motivated, text messages. They have all these technology now where they can feel together as a team. And they should have team goals. There are virtual team games now that are being developed. This is an example of one of them where you have patients or athletes in different locations who can be passing the ball in different locations. This is just testing the system that they're creating called Alone Together. um, Here you go, that guy didn't catch the ball. Try again, still didn't catch the ball. So not so much of an athlete, but athletes will catch that. Anyway, so there are also apps that you can mindfulness and visualization. These are keys for elite athletes in particular. There's been studies that show that the difference between a regular athlete and an elite athlete is not so much the physical skill a lot of times, but the ability to visualize what they're able to do even without the game. So that ability is maintained with mindfulness. So you have these apps like Calm, Headspace, 10% Happier, which can help your athletes continue to train their minds in preparation for the when the pandemic ends. What about playdates? I'm sure this is not just for athletes. I wanted to put this in because some people are still discouraged, but here, especially in the U.S., and I'm sure as well there, it's very important for kids to still have playmates. And so virtual playdates are a thing now. My child likes to do that with his playmates. You can have them play across the street. There's no sharing though that as much as possible of things to play with. And so if that is to happen, mass social distancing, hand washing, and surface cleaning, including those balls that are being passed across the street, if ever need to be done. What about if a child or adolescent gets infected? They're actually allowed to play as long as they're comfortable and interested. There's a below the neck rule in sports medicine. If an athlete has symptoms below the neck, probably not so good to have them do vigorous activities. So fever is one of those things, especially with COVID, that you watch out for. They can't do anything vigorous with that. Obviously, lots of fluids and rest as needed, and as much as possible, it's important to isolate them. But they can still play or do more vigorous activities if they don't have any fever or any significant symptoms below the neck. So I tried to list a lot of resources that are cheap or free. So these might be things to Google after this talk. And I certainly send these slides to Dr. Napalinga and the rest there just to refer to. But Cosmic Kids is $10 a month, not so expensive. You have all these activities for kids. Go Noodle is another one. You have all these activities that are free for families to do. And then Open Phys Ed, which kind of leaks into the next talk, but it has these handouts that you can print out. And then the American Heart Association has this heart healthy living infographic that you can print out and go all through these 25 things that you can do at home with your kids. There's also Playworks, Play at Home Playbook. They have videos like this that are free, where you
Hi,
can
my name's Coach
actually
Brando.
have
And you
activities
can before you catch it. To
where
play, perform.
they this is just one activity that you can play with your kids. They just pass the ball around, clap. Just an example. That's free as well. You can have a dance party, have a child DJ, and have them all do their best dance moves, or color hunt. Have them. You can hide colorful objects and have the kids bring them back running, jumping, swimming, skipping, crawling, or dancing. Nerf basketball, indoor obstacle courses, paper plate badminton like this, Martial arts is awesome because we just make our kid do his forms, and that's exercise for him. Instant recess is another thing where you have hid timers all over the house, and when something alarms, everyone does 50 push-ups or something like that. No touch scavenger hunt. You can walk along the neighborhood and you can have a list of things that your child will point to. You can obviously bike, skateboard, or scooter around. Um, you can do trails, walk your dog, outdoor. I mean, trails are awesome too because you can social distance. I'm sure Dr. Napelinga saw my pictures on Facebook of our family hiking the Olympic National Park. It was we're pretty alone and a good way to do things in this pandemic. You can do an outdoor obstacle course, which one of my friends actually made for his family. Hide and seek is awesome. You can hide plastic eggs or other plastic toys and have the kids search for them like an egg hunt. Whew. All right, last topic, conducting physical education classes online. So we know that more than 17% of US children are overweight. This is obviously not the case in the Philippines, although a couple of my friends in the medical field is saying that the Philippines is catching up, which might be a good thing. It might be a sign of improving economics. But in the United States, it's more than 17% of children are overweight. So the daily recommendation is an hour of moderate to vigorous activity, but most children here in the United States do not meet these recommendations. So moderate, I guess more applicable baseball, softball, but like brisk walking, bike riding is a good thing. Making them do housework, as you can see. So that's an excuse, right? So ask your children to do housework, sweeping, mowing, which is obviously a big thing here in the States. Playing basketball, which I know I used to do because we had a basketball court in our house. But volleyball, bike riding again, martial arts, which my kid does. So that's quite vigorous. Now, all these online stuff is very new relatively because of the pandemic. But there's little research comparing online PE with traditional PE. What's been studied a lot is exergaming. So there's more physical activity apparently, an opportunity to engage in physical activity, which is defined as the presentation of an activity which the child has now a choice to whether participate or not. And it seems that for about every 2 minutes of physical activity in traditional PE, there's about 9 minutes of physical activity in exergaming. And for about 4 minutes of traditional PE opportunity for physical activity, there's about 12 minutes of OPA for exergaming. And they did a study on Dance Revolution against other possible activities, and it had the highest percentage of physical activity. I remember when I was in Pisay, we used to go to SM North EDSA. Not sure if it's still there, but we used to go there, and my friends and I used to do this. It gets pretty huffing and very challenging at the very end. So I can understand why it won against Wii baseball. I tried Wii tennis once. That was fun. Wii boxing I haven't tried, but that can be a bit challenging. Game bikes can also be hard, but Dance Revolution one. So there's one of your ideas for physical education. More research is definitely needed, comparing different age groups, comparing active versus inactive groups. How about children with behavioral difficulties? How about different games or machines or equipment which will give you the highest levels of PA? More research is needed. So this is brand new stuff, guys. So if you want to do research in the Philippines, definitely this will be publishable if you go and study those. One thing that I can say then, based on the research, is that online P definitely exergaming should be considered, but obviously you come into costs, equipment and computer failure. You have to see which ones are cost efficient, reasonably priced, require the least maintenance, and result in greatest levels of PA. They now have a folding Dance Revolution that, at least for me, I think it's cheap, so that might be an option. What they have found in studies too is that you don't have to have equipment that is novel to have more physical activity with online PE compared to traditional PE. And even those who are students who are overweight or obese, they tend to actually participate in physical activity more when it's online than when it's traditional. There might be a bit of shaming that's going on with these students who are overweight or obese when they're together with their classmates who are more who are thinner. And what's also been interesting is that in traditional PE, the actual physical activity that goes there is actually lower than what parents believe. And looking back into PE that we did when I was still there, there were times where I didn't want to participate. And let's talk about traditional PE, which kind of similar to what we did in Marist when I studied in grade school. We would gather. The teacher tells us what we'll do, and then the whistle would blow, and some of us would love it, others would be completely disengaged. Everyone has moved around a little by the time the bell rings. But with online PE, it's the same objective: get the students moving, but the students get to choose their activity. This is the effective way of doing online PE. The engagement seems to be higher with this. And you don't require any specific equipment or exercise. You can see this kids just doing jumping jacks. And you can use what environments or resources are available to you guys. Strength training has to be in there, especially for athletes. They can run, walk, they can do their individual sports. They can document with a log. And then the main thing is that these logs have to be checked by their parents or supervising adults, and they have to sign a verification form. And they track their activity week by week, and there's monthly checkpoints. So here's an example in one of the best schools here in the US. So what they do is they require 3 hours of physical activity each week. I won't name the school, but it's a good school. So you can see it's nowhere near the required 7 hours of physical activity each week. What their philosophy is, they'll start with 3 weeks and the parents can do the rest with their kids. But at least they should have 3 hours of physical activity. 90 minutes of that is cardio, 30 minutes of that is strength, 30 minutes of preferred activity choice, and then 30 minutes of flexibility mixed onto each workout rather. So the activities engage in activities, I mean, the students engage in activities of their choice and they record them in activity logs. So for the cardio, their goal is to do anything that will raise their heart rate. So they're taught how to calculate their target heart rate. So 150 minus their age. So if it were a 10-year-old child, it would be 140 to 190. They need to go there at the end of that workout. They are taught to check their pulses and see if it's there. A heart monitor certainly is not required, but although a lot of our kids here already have iWatches and smart watches that can measure that, but it's not required at all. They can walk, they can jog, you can use a treadmill or do anything as long as that heart rate goes there. That's considered their cardio. And then for the strength, they can use bands like these little kids here, free weights, or they can do push-ups, their own body weight pull-ups, anything that build their muscle strength. So they have a whole list of them and drawings like this one. And then these flexibility exercises are mixed in at least 5 to 10 minutes after every workout, whether it's cardio or strength. And then they're actually observed by their parents doing that or by a supervising adult, and then the parent or adult has to sign. So it's a bit more involved as far as the parents are concerned. But like I told you a while ago, studies have shown that in traditional PE, because there's not that one-on-one thing, there's actually less PA that happens in traditional PE than we really thought. Hey, we reached take home point. So all right, so now we go to the take home point. So for a team physician, if you ever go, I've seen the national teams from the Philippines for Taekwondo. They don't have a team physician. The coaches act as team physician, but someday I think we will have team physicians not just for basketball and soccer and all the big or boxing or the big money sports. I think if we we have to know the ADHD, we have to know the resources in the community. We need to treat athletes in a multidisciplinary manner and be aware of which athletes are on medication. Watch out for the side effects on the CNS and the obviously the overheating that occurs on these medications. If any of our athletes get to the level where they are Olympian or elite level, we need to know the guidance of each sport and organization. So for like I said, basketball, which is the popular sport, there it's FIBA rules, and then world with boxing, it's World Boxing Council or World Boxing Association. They have their own therapeutic use exemption papers, which we need to know how to fill out and monitor and all that. As far as the highest level of evidence when it comes to sports specialization, what we can say is that if it is structured, not just some kid playing basketball, but a kid who has a coach or who's a part of a varsity team or who's part of the neighborhood team and they practice in a structured manner, that actually may be detrimental based on limited studies. And if the goal of your athlete is to get into the pros, most professional athletes actually competed in sports off seasons and actually were multi-sports athletes, anywhere from 5 years old to 9 years old, and were multi-sports athlete longer, anywhere from 9 years old, 10 years old to 15 years old. So that might actually shape the opinion of your young athletes. Oh, maybe I should dabble in other sports. So with my son, for instance, I'm trying to get him, he's obviously in martial arts, but I'm trying to get him to swimming and soccer just to uh, put in the mix. And he likes to dance around, so I'm putting him in some sort of dance class later. But martial arts, soccer, and swimming, that's his thing now. If you do want your kids to you do want your kids to still be active, especially your athletes. They have to still be try to be 6 feet from each other, like these guys, and everyone has to wear a mask like these athletes. And then constant hand washing, surface cleaning. I can tell you, the do I mean the taekwondo gym is being cleaned more than usual now. Before it was once a week, but now it's daily. If they get infected, they can still play as long as they're comfortable or interested. No vigorous activity if with fever, fluids and rest, obviously, and then isolate as much as possible. The recommendation is 60 minutes of moderate to vigorous intensity exercise per day. And then these four components have to be in there for a successful PE, in my opinion, and based on science. So cardio, strength, a preferred activity, which seems to increase engagement in children and adolescents, and flexibility mixed inside. These are my references. And this is pre-pandemic. My son breaking a board for the first time at 5 years old. This is my email, and thank you for your attention.
All right. Thank you for that very comprehensive and evidence-based lecture, Dr. George. It's
I did it for topics that you wanted, right, Dr. Napoleon?
thank you, and I guess it's really refreshing to hear it from a researcher's perspective. No, but now I'd like to hear from our audience. So I'd like to invite everyone if you have any questions for our speaker this morning. So we had a question actually. It came from Dr. Tipitan Chanko, but she had to step out briefly. So she just wanted to ask what your take was on nutrition for children in sports. Like how much importance do you put into that?
Yeah. So clearly, the importance of nutrition in sports is, like in the elite levels, is like almost automatic. We have sports nutritionists, but a balanced diet is very important for athletes. Um, the performance of athletes depends on how good they are, as far as not just not just being eating carb laden diets, which is I think what we have mostly in the Philippines, a lot of rice. But there needs to be like a rule. So sometimes we describe the plate as having to have like one fourth, um, one half of these should be fruits and vegetables, and then one fourth of that should be meat, and then one fourth of that should be other things. So there has to be balance. There's also timing. So after marathons and after there's a lot of like regaining the energy from carbs, as well as a lot of protein. It depends on the sport, but and I guess the short answer is it's very important, and it depends on the sport. But the main thing is to be balanced and to rely on natural diets rather than supplements, which I think is a temptation for a lot of athletes. Is to supplement, whereas studies have shown clearly that getting your nutrients from fruits and vegetables and actual sources is better when they're extracted and made into supplements.
All right. There's a follow-up question also from Dr. Tip.
Mm-hmm.
What about
Mm-hmm.
kids, because when they, with ADHD specifically, when they take in
Mm-hmm.
methylphenidate, it usually decreases their appetite. Do sports medicine
Yeah.
people deal with that, if ever that happens? Or
Which one? The increases their appetite?
I mean, with the decrease in the
Yeah.
appetite, how
Yeah.
an athlete who is taking in methylphenidate for ADHD and has a decrease in
Mm-hmm.
appetite, how does your team address that, or have you had experience with that specifically?
Yeah, so what I have noticed is that when these athletes are on medications, they tend to be now like normal individuals, whereas more like the opposite, where they're not on medications, they tend to be more like thinner, and they burn their energy more because they're moving more. Whereas when they start to be on medications, they're now able to control their movements and be in a more controlled manner. Also take in the appropriate amount of nutrients for their sport. So what I've noticed actually is that where they are on their medications, it's easier for us to control their weights on the diet that they're supposed to be based on their sport.
All right. So, sir, do you have a question?
Yeah, Dr. Dimayuga, Dr. Pojalte, I'm an orthopedic surgeon.
Hello.
Yeah.
Hi, sir.
So anyway, there are two questions. The first one is the use of masks when exercising.
Mm-hmm.
I run regularly, and wearing a mask is one of the hardest things to do when
Yeah.
you're jogging and
Mm-hmm.
doing exercises like that. So, has there been studies now since
Mm-hmm.
the pandemic, and you are actually recommending your kids to be wearing masks and the
Yeah.
usual social distancing? Does that actually affect their performance or any adverse
Yeah.
effects? That's the first question.
It's hard.
Yeah.
Yeah, so it's hard. So like in that photo that I showed you in Taekwondo, the kids are in masks. So the one that we've found is the material of the mask. There are some moisture wicking materials that allow the mask to kind of dilute and evaporate the moisture better than the cotton masks. Initially we were getting like masks that were cotton ones with a cloth top there, and finding that they were so sensitive that it was more difficult for the athletes to breathe. With the material itself, what works if you look in the Nike sports shoes or the sport you can see that and so I know a couple of my friends have passed away from this already. So I still kind of stay in masks as much as
Right.
possible. And your second question, Dr. Dimayuga, I didn't
Yeah,
quite
well,
get.
the second question is basically in terms of the multisport.
Yeah.
Has there been studies by, let's say, you are really into basketball?
Mm,
What other sport would be a good match to get the benefits you were mentioning? Basically, and
mm-hmm.
what drives a, you know, because basically people go multi-sports depending on interest, but if you
Yeah,
were to guide a kid, they would eventually
like soccer or football in your case soccer
right, right.
apparently improves the footwork and the starts and stops that decrease the likelihood of ACL tears as far as injury. So soccer and basketball seem to complement each other very well in terms of footwork being planned correctly that decreases knee injury. So in that sense, I guess soccer and basketball would be a good fit. In the U.S., American football, they say it's a good fit for basketball. Not so much for basketball, but more for the advantage in
Right.
football because with the basketball, they have better footwork, catching the ball in the midst of all these players trying to swat the football. So they think basketball is much advantage for American football. But in the Philippines, I imagine if you have someone hoping to be able to swim, definitely suggesting that soccer is a good complement for basketball for someone who wants to excel in basketball and reduce the likelihood of injury.
Weight training.
Yeah, thank you for that question, Dr. Dimayuga. So it's very it's very confusing to laymen, but for researchers, it's clear. There is no evidence that starting early with strength training leads to higher injuries to the growth plates. What's been mistaken is that a lot of growth plate injuries when happen when it's excessive, and then these growth plate injuries become like known to a community, and now people are saying, "Oh, look at this kid," So there's been incidental reports of those, but when you look at the whole population, if you do it safely, you can start strength training. So I bring this chart back because it's important. So you can see here at 2 to 4 years old. This is one of the elite strength and conditioning guys here in the U.S. At 2 to 4 years old, you can start strength training, but the emphasis, Dr. Dimayuga, has to be on reps rather than load. So you're correct. Excessive loads can break the growth plate. So the emphasis as well is foundational movement skills. So let's say basketball, which is the most popular sports in the Philippines. So there will be a lot of eccentric strengthening of the arms with very low weight dumbbells, even just cans of sardines maybe, just to show the little kids, oh, okay, I can lift that. There's a difference though between strength training and bodybuilding that can be dangerous in kids. So but that can still be done actually safely if watched very carefully by a specialist. Strength training emphasis is reps rather than load. They are watched carefully, and the strength training is foundational movement skills. So please feel free to advise your patients with that, and emphasize the reps, and also being observed why they do that. Don't just tell the parent not to just lead their kids with the in the gym. That would be a method to have a disaster, I would think.
Thank you very much, sir.
Of course, thank you, Dr. Demir.
Thank you very much for that question, Dr. Dimayuga. I'd like to acknowledge the presence of our ortho team also with us in the audience. Do you have any other questions? Okay, so there's a question here on the chat box. So there's actually a plan to start a sports academy in Clark, and I guess you already mentioned
Mm,
that the impact on young children. So the question is, what
yeah.
is your opinion on countries and institutions who train their kids early, like China, for example, wherein they train their kids as early as 4 to 5 years old?
All right. So clearly they are successful. So there is a way to do this. And okay, so I should go back to that slide. I keep showing my email because I love questions. So if we run out of time, please email me. But so this again, there's a safe way to do this, but their technique is starting with a huge base of promising kids. It's not just autocratic countries. Let me be clear. It's not like China or Russia. In fact, in Europe, there are soccer teams that have 5-year-old superstars, so called. So they know how to do this, but the foundation is strengthening once again. So and then they see by observing these kids that it can be done in a stepwise manner. So I think in settings where there's not a lot of budget, like in the Philippines, I presume. Although from what I've been hearing, the Philippines is not economy is now improving. I'm sorry, my son has just arrived from the swimming pool. Anyway, so what was I saying? So yeah, scientifically good way to do this, where I presume we can go all over from the top to bottom of the Philippines, get promising kids, and like in these countries, give them a stipend, give them an education while they're training, but it has to be a stepwise manner. The ones that we have observed in Ukraine or Romania, the gymnasts like Nadia Comaneci, her colleagues injuring themselves, this is in the setting of not a scientific method of training them and forcing them to be good at things at a very young age. But there is a way to train these kids from apari hanggang holo to be very good at. And I would say like soccer is a more promising sport than basketball, to be honest, or swimming, because we're a country filled with waters. I think I've actually had invitations to visit that or be part of that Clark thing. I think that is the way for countries with very limited resources to focus and actually come up with gold medalists, which is known all over the Europe and in Asia. In the United States, it's a little different because there's a lot of money in sports. So if you can just imagine the University of Michigan, where I trained, they earned $200 million from football alone. That's just football, and that's just tickets. Doesn't contain the T-shirt sales or other like posters or whatnot. That so we don't have that. We need to have to find a way to get these promising kids, put them in one setting, and safely train them in a sport that they seem to be good at in the interim. So I imagine it will be going from province to province, holding these little clinics, tennis clinic or swimming clinic, and then saying, "Hey, this kid looks promising, or he has the build for it." You can say as well that swimmers tend to be taller. Obviously basketball they tend to be taller, but that can change along the way. That's why I think soccer as well as swimming might be, or soccer, boxing even could be other, or weight-based sports. Those could be things we could engage in. It's a long answer, but I've given this a lot of thought. I think it's promising approach for countries such as ours, the Philippines, where we don't have as much money as the United States.
Thank you for that.
Thank you for that question.
Thanks for that, Dr. George. So
Mm-hmm.
target to end at around 10:10. So we have, I guess, time
Mm-hmm.
for at least two more questions. Mary Ann, do you want to
Mm-hmm.
add more questions for our speaker?
Yes, sure. Just yes, sure. So we're doing a lot of online sessions and
Mm-hmm.
teleconsult now, and of course, motivation and participation is key, but can be challenging. Is there
Mm-hmm.
any research or advice that discuss if the children are more engaged or participate more, as well as better improve when in a group setting versus individualized one-on-one, or maybe versus a smaller group like three
Yeah.
kids or two.
So there is preliminary. It's not yet been published, but we actually have been trying to do this. So we have shown that in a group of five, the threshold seems to be five, and the parents have to be there. More than that, it appears to be chaos, and the way to do it is to mute everyone and just watch one person. But uh, below that seems to come up with to result with better engagement. So five pairs of parent and child, seems to be the threshold. There has been also evidence that, as far as sports, if the more individualized coaching is, the better the outcome. So as much as you can approach one person, that's the best. Obviously, given economics and the availability of your experts trying to teach these parents, you might go as far as five. But beyond that, again, you come across that traditional PE thing where you think they're doing things like you told them, but they're not doing it. So, and it's hard for even you to pay attention to everyone you're seeing, whether, hey, you're not doing it. What about you? So five seems to be the threshold for that. But approach one to one as much as possible if it can be done.
Okay. Thank you for that.
Of course, of course. Thank you for that question, Dr.
All
Mars.
right.
Uh,
Any more questions, Mary Ann?
I know, but I think there's
Mm-hmm.
one in the chat box.
Yeah, sure. Go ahead.
There's a question: should a young kid avoid weight-bearing sports like running more than swimming, primarily because of their developing bones?
Mm. So this kind of reflects what Dr. Dimayug had asked about, which is like real weight bearing, where you lift weights, and it has not been shown to be detrimental to children if done in a controlled manner, as well as um, when you do reps. So the equivalent for that in running would be mileage. So the mileage has to be gradual. They should not be developing anterior tibial pain, which is development of shin splints or the medial tibial stress reaction that we fear in young athletes like these. So the short answer is no, there's no evidence that children cannot do weight-bearing exercises, or there's an advantage. So what I suggest that parents do is look for what makes their children happy, so that they can be involved in the sport that they like, rather than what you think they can get into scholarship to. Because a lot of our parents want their kids to be football players or basketball players, or sports where there's lots of money when they go into the pros. But in the beginning, at least until 12 to 15 years old, our advice would be to play as many sports as possible that your family can handle, and that your kid is having fun with. Because if they're not having fun, then it's probably falling into the routine, or something that they don't like, and will cause burnout and injuries. Actually, studies show. So, fun, 12 to 15 would be the time we are starting to decide what sport. And running, weight bearing sports is not off limits for kids.
All right. So I guess that's our last question for today. Thank you again, Dr. Pujalte, for being with us and giving your time. So you
All
already
right, thank you.
also for everyone who is here with us today. If you have any more questions, feel free to email Dr. Pujalte. And
Yeah, so one thing that I want to say is that a lot of our research that we do actually comes from questions from all over the world. So if you ask questions that are intriguing to us, one of these days you might actually read on it and then say, "Hey, I'm the one who brought that up." So it's very helpful, not just for us, but for obviously people all over the world who read our studies.
wow. All right. So that's very
Yeah.
to hear. Can we actually partner with you for a research paper?
Of course, yeah. I mean, I'm trying to do that. Obviously, just it's just a time difference. Every time it's evening here, it's morning there. You guys are working, and when I work, but email obviously in the weekends is good. Yeah, we'd love to partner. I'm trying to do acupuncture studies with one of my colleagues, Dr. Tangatwe. That's one thing, and before I moved to Mayo. But I love international studies. We did a study where I private messaged you on Facebook on the willingness of doctors to cover martial arts. If you remember years ago, you'll see that private message. So there are studies that we can do internationally for sure, and we are used to doing that.
All right. So that's very good to hear. So for the fellows with us this morning, you heard that. So just message him. Okay.
Okay.
So with that, we end today's session. Again, thank you very much for everyone who was with us on Facebook and everyone with us this morning. Thank you. Thank you, Dr. George. Thank you for the ortho team, sir. Dr. Dimayuga, thank you for joining us. So
Thanks, guys. Bye.
Thank you.